Nothing can replace touch and feel while you're doing FUE or follicular unit excision, because the characteristics can change per graft. And sometimes the punch breaks through the skin really easy and the graft can just come right out, it's released. And other times it's difficult. So without that minute feel of the skin and actually visualization, I watch the skin come up into the punch under loop magnification, and if it comes up into the punch and I'm not pushing, it's almost 100% that I have a fully intact graft. And so it takes a lot of concentration, a lot of feel, graft after graft after graft, to get it done right.
That was the voice of Daniel A. Danyo, MD, founder and physician at North Atlanta Hair Restoration, a boutique medical practice solely dedicated to the diagnosis and treatment of male and female hair loss. And you're listening to Hair Restoration with Dr. Daniel A. Danyo. I'm your host, Clark, and all season long, we're speaking with Dr. Danyo about how he and his team at North Atlanta Hair Restoration are helping his patients transform their everyday lives for the better. In this episode, Dr. Danyo and I discuss the differences between robotic hair transplants and his own process of no-shave FUE treatments. He explains some of the disadvantages of working with a robot and shares some of the factors that set his work apart in both the patient experience and the quality of results. There's so much to talk about, so let's dive right in. Dr. Danyo, how are you?
I'm doing great. How are you, Clark?
I'm great. I have been looking forward to another great conversation with you. I'm always learning so much. So, I've been hearing about robotic hair transplants, and I really wanted to understand first just what that is. And I want to hear like what that is compared to what you do, because what you do is all by hand. It's all very different. But what in the world is a robotic hair transplant? I just want to dive straight into that.
Sure. You've heard of robots doing surgeries before, and it's the same concept. The robot is programmed to grab follicles, and essentially all it does is it has a punch that creates a circular incision around the follicle, and then it goes to another follicle and then to another. Now, it does not suck the follicle out. The actual follicles have to be hand pulled, because you're really in a very static position. You're kind of sitting in, those massage chairs where you sit in the chair and you get them at the mall?
Right.
Yeah, it's something similar to that. Your head is kind of fastened into a skin tensioner, and then the computer maps things out and then, starts coring. So that's one of the main functions that the robot does. It's just core grafts. It does not pull them. They actually have to be hand pulled. And there are newer versions of the robot that do some placing and also surgical slits where it'll go in and do some small holes that you would later place the grafts into.
For some reason, when I'm hearing you describe this, it sounds like it could either be painful or really uncomfortable. How does it measure up to maybe the time in the chair or overall, does it?
Sure.
What do people have? Do you know people who've done this? What do they say about it?
Well, one of the biggest complaints is just being in that massage chair position where you're kind of kneeling, your knees are flexed, and you cannot move, and your head is in the tensioner. I've had a couple people say it was almost excruciating being in that position for that long. And with me, if somebody said, do you mind if I move my shoulder or my neck, or can I sit up for a second? No problem. And, if they need to change position, I guess they can, but they'd have to be taken out of the tensioner and, have the robot kind of get set up again. My opinion on the robot, because I'll be honest, Clark, I have people ask me every week, I do a lot of online consults, and people say, are you doing the robot? And I say, no. That's not what I do, and it's something that I've worked hard to be better than the robot. I'd like to talk about some of the pros and cons of the robot and kind of reflect on how it really differs from what I do.
Yeah, I would love to hear a pro-con list.
Sure. Well, I think the
Hey,
big.
do you call it the robot? Is that really just the...
Well, I mean, so the trade name is called Artis, ARTAS. Is the Artis robot is the main and pretty much the only one doing a hair transplant robotically.
Okay.
I'll be honest. I think the major pro for Artis goes to the doctor, because the doctor's not doing the case, and the doctor can be doing something else. So, if you're the type of patient that wants doctor involvement, the robot method may not be the best because the doctor's kind of not part of it unless they're part of the programming, of the computer for each patient. But the actual extraction of grafts, they're pretty much out of the mix. And when you throw in, they're doing surgical slits now, it takes a lot of the artistry out. And the doctor, again, I guess, can see other patients and make more income that way. But that's one of the main pros, but that goes to the doctor. From a patient standpoint, compared to what skilled physicians do, with more manual techniques, I don't know if there are any advantages to the patient. FUE, or follicular unit excision, which is what the Artis robot does and what I do, is very hard. And it is something that there are just so many factors that go into it. The skin depth, the skin tension, is there curl, is there splay? And all of this comes into play when you're extracting. And after doing myself over 2 million extractions, I've been through every scenario. And sometimes I have to apply a little tension, sometimes I don't. And in general, the more tension that you apply to the scalp, the firmer the hair gets. And if you have a straight, a punch going through, sharp punch, it can get transections. And really, if you look at the rates of transection, I think they're higher, much higher with the robot than what I have. It is even as high as 20% that I've heard.
And so what is that word again?
Transection means that you cut the graft. It could be anywhere in the graft. For my patients, we do occasionally get them. We end up, if they're long enough, we'll put them in, but we don't count them. I really strive to get my transection rate as close to 1% or below as possible. And it involves my full participation, coring, pulling the grafts, looking at the grafts, going to the next one. It takes hundreds of grafts until I really have a comfort level. But I never have a comfort level because as you go around the scalp, the dimensions of the scalp change, the elasticity and tightness change, and you have to do different things manually to get the grafts out successfully. But you have to have feedback immediately to determine that. Does that make sense?
Right. There's just a lot of data points that a machine is just not going to be able to understand.
Well, I mean, a machine that is, you're laying in one position, there's a tensioner on, and then the machine is just coring. And the question is...
What's coring again?
Where you're creating a circular incision around the graft. So for me, when I do that, I'm not that far ahead of my assistants that are behind me pulling the grafts. And if we have issues with transections, they will stop me. And sometimes, motion to me to go in the room and say, we have a little bit more than usual, or let's say we're going for 3 grafts and you only get 1 follicle instead of all 3. That in my mind is unacceptable. So, the robot doesn't have that feedback loop, and it's just going through and just coring, and then the tensioner is taken down, and then the technicians go through and core and pull the grafts, and you could be hundreds of grafts into it and realize that you've got a lot of transections. And for me, it's just not acceptable.
No, that sounds really, potentially, scary of a set it and forget it kind of visual I have in my mind where a doctor, they set this machine up and they might be doing something else. They're making more money
I think the real, if you look at the true leaders in our field of hair transplant, many of them started out with an artist when it came out. I remember early in my training, back in like 2012, just being like, oh my gosh, this is like the newest, best thing. And so a lot of, the big names got the robots, but they don't use them now. And they don't use them because of what I just talked about. And the fact is that you have to be involved in the case and you have to monitor what's going on with the grafts, not let things kind of perpetuate because you're in a hurry to just graft. Because when it comes down to it, I mean, we're managing somebody's bank account. And for me, if somebody was skimping dollars off of my bank account, I wouldn't take that very well, and I really, I have such a high level of OCD when I do this. I can't see the artists, really doing that because it's taken that OCD, that physician, determination to do good out of the equation.
Well, you were talking just a moment ago about some of the things that a machine or a robot may not be able to see, and you use that word like an artist. So you're talking about different things like the way a hair curls or how you position a hair. Is there anything else like that? Any other examples of? Sure. I might just not even think about all the things that you're thinking about after you've done, like you said, over 2 million of these.
Yeah. Well, I mean, you look at, one extreme, which would be African American hair, which has, either a J curve or possibly a total C curve under the skin. And it's something that you have to have minimal tension on the skin, if none, and kind of slightly score the skin and literally have the punch sit there and have the skin work itself so that the graft works itself into the punch. And, again, this is something that I've developed this finesse for, which is in stark contrast to having a scalp that is fully tensioned, and then you're taking a sharp device and cutting through. So sure, you can kind of straighten out some of the C curve if there's a big curve, but it can also tension that hair so that there's no give, so you have a sharp punch going through and cutting it. So when you graft around the ear, it's different than just above, kind of in the middle part of the scalp, which is a lot more fleshy. There are just so many nuances. And the key for me is that, if I'm going to do 2,000 grafts, I'm going to be very close to 2,000 attempts with minimal transections and very good-looking grafts that are not fractured. If we're going for 3 or 4 follicles in a graft, we're getting all of the follicles, not 1 or 2. Now, I'm saying this without having personal experience, using the artists. But, in reading, talking with other physicians, and really my general concept that the doctor has got to be involved. Like you have to have skin in the game to make this experience work. Because really the patient has a golden opportunity during the case to have it done right. And so it's got to be done right.
If it's not done right, I mean, has someone ever come to you and said, hey, this other person, maybe it was a robot, maybe it was not, just some other place they went. Do they ever come to you and say, hey, can you help me fix this?
Sure. I've had many patients.
What goes wrong? Hey, can you help me fix this?
Just poor growth. I did have a patient that had a robotic procedure, pretty large, and it was very thin hair that was left. There just wasn't a lot of definition, and I showed him pictures of what my patients look after 2,000 grafts, and He was blown away. So we ended up doing another 1,500, and I mean, he's super happy. In fact, he's got a great review on Google describing it. But I've seen that, and it is so important that the physician is involved. In more and more states with hair transplant, I know Florida's got some stricter laws. The doctor has to be involved. It can't be technician run. And, a lot of these companies, they don't market to experienced hair transplant physicians. They market to people that are, say, dermatologists, plastic surgeons, family practice. They're looking to do more cosmetics in their practice. And the problem is hair transplant provided by a robot or whatever is not just a procedure. It's actually a field of medicine. So you have to have the knowledge base to deal with all aspects of the evaluation, the actual execution during the hair transplant extraction, and placement to make this thing work, or it just doesn't, and it can be devastating.
That would be really, really bad, because already someone is going to a solution because, it's really important to them. It's an investment. It's something that they're really trying to do, and so if it's not done right, that is quite tragic.
Yeah.
And, I always love talking with you because I love hearing the passion that you bring to this work. And when you think about these other folks out there, if they're offering it, it's likely because they're doing a bunch of other things. It's not a specialty, it's not a focus. This is something that you're also doing all of this. You're not handing it over to a technician to replace you. This is a boutique practice. It is you.
Yes.
Right, and for better or worse. I mean, you're the one doing everything, and it takes a lot of time, as I've learned.
Well, I mean, it just takes intensity, and intensity doesn't necessarily have to be a bad thing. I mean, intensity can be fun. Intensity when you're grafting and things are going really fast and you're getting great grafts. I mean, it's an exciting, thing to be part of. But then on the flip side, I've had extremely tough cases. Last week I had some very hard cases. In fact, did my oldest patient ever at age 80.
What?
Yeah.
I never even knew it. Is there an age?
No, he's otherwise healthy and has a young wife and wanted hair. So who am I to say no?
An age.
But, even with the tough cases, it's not a race. I mean, sometimes I just have to slow down and we have to change gears. And it takes that physician mindset to determine, what needs to be done. And that can be whether it's patient comfort, anesthesia, bleeding control, but ultimately it comes down to results. And you have to get out the grafts properly, and you have to put them in properly in context with everything that's in association with why they actually have hair loss in the first place.
That is a good point, because you're not just going to see someone and then they're leaving. You're having that consultation. You're having that deep dive with them to understand maybe why this is happening.
Yeah.
And that's got to be different for different people.
Sure. There's one thing that people assume that the latest technology is the best thing. And it's just not there with hair, from what I can tell. And the fact of the matter is that there are too many variabilities with patients with skin type, hair type. We talked about that. But also from graft to graft, it changes. And so it takes intense knowledge, intense feel to determine how am I going to get this follicle out? Because sometimes they're tethered more from one follicle to the next. You could have 5 that come out easy, and the next 5 are really tough to get out. And so I think if you take this approach, one size fits all, it doesn't. And particularly, some other issues. I mean, Artist does great with black hair and white skin. It doesn't do as well with darker skinned individuals because there's not as much of a depth of field and contrast between the hairs where it can count 2s, 3s, and 4s. It doesn't do well with blonde, especially gray hair. It has to be shaved. Most of the grafting is, kind of... they're like little kind of bony ridges that are round on the sides, backs and sides of your head. If you go, straight up from there, kind of like goalposts, it can graft there. But, we do a lot of excellent grafting from just in front of the ear and up from there. It doesn't really do well there. So we're able to use more of the donor site. We're able to do shaveless or no shave procedures that can't. And we're able to do these on people with curly hair, dark skin, gray hair, blonde hair, where it may possibly struggle.
We've talked about a procedure called No-Shave FUE. So just the idea of having to shave parts of your head, that's not good because part of what you're doing is keeping this discreet, and someone can come in on a Friday and they can... you've had patients that go in on work on Monday and no one, they're able to do that.
Yes. Yeah. And, we've perfected the no shave. We've got a couple podcasts about it, but the fact is 70% of my patients last year were no shave when we looked at the numbers.
Whoa.
And it's because they don't want a weird haircut. And the majority of the people that we did shave cases on are like a number 2 or less. That's how they wear their hair anyway. So it's like, just shave it. It'll be easier.
Got it.
But we do 100% of our women are no shave. And that includes extremely long or possibly even, more kinky hair, say with African American females, and that increases the complexity. I mean, these are all kind of more super level things that I just don't see the robot ever being able to complete, and it's that's really what people want.
Right, that makes sense. This has been really interesting. I appreciate you going into all the pros and the cons and why you don't engage with this. And I'm sure, if you wanted to just have create an empire, you could get a bunch of these machines and go that route. But
yeah,
it sounds like you've really chosen a different path.
I'll be honest. I looked into it, but it was a very kind of fleeting moment for me. Just more of an interest. I went to a conference and there's presentations, and then you see the sales things and you think, am I being too callous about this? But when I really talked to leaders in the field one-on-one about it, they said, this is something that you're past that stage. You know what I mean? Keep doing what you're doing. So they did not recommend it.
Right.
And the other thing is just, it is a very expensive tool. In the hundreds of thousands of dollars, plus the disposables per case are extremely high. So for me, it just didn't work from a business standpoint or from a principle standpoint.
Final question. Do you think these other leaders in the field that you mentioned, do you think if you and them maybe looked at a comparison, like you didn't know who had this done by hand or who had this done by the robot, would you be able to tell a difference?
The robot, for the most part, is just creating that circular incision around. I think if you took maybe average people with darker hair and lighter skin and without a lot of, issues that we had talked before with curl, and maybe a very simple skin type, there may not be much of a difference. But the problem is that you have these devices being bought by people that have no training in hair restoration. So the robot does all this coring.
Just hook it up and see what happens.
Then you've got to handle the grafts. Then you've got to sort them out properly and then put them in properly. And we had talked about the individual that had some poor growth. And I really think it was on the implantation side and possibly on the extraction side as well. But
interesting.
Yeah. So,
well, like here's one potential way. This just came to mind. So, Dr. Danyo, this quarantine time, I've been getting into plants and just learning about plants, and I got some plants, going to the store, buying plants, whatever.
Uh-huh.
So I'm curious, the leaves at the store, they might look green, might look good, but you don't know, the roots underneath might not actually be healthy.
I've killed many ficus trees.
So, I mean, the thing that's coming to my mind is, after the procedure, you might not be able to tell a difference, but what I'm hearing you say, there might be things beneath the surface that, that maybe we've talked about how this is sort of comparable to like a tree. You uproot the tree and replant it.
Yeah.
But if it's not planted well, that could be problematic.
Yeah, I mean, you want results, and this is not. You can get caught up in the glitz of a robot and things like that, but you also have to do your due diligence on who's actually doing the procedure. What are their credentials and what do they do? I mean, there are a lot of respected hair restoration surgeons that use artists. Don't get me wrong, and do great work. But at the same time, there's so much hype about it. I hear it all the time with the consultations that the company wants to sell more machines. They're not
right.
They're not, and ultimately they want the best results because that'll probably generate more machines. But they want more cases because they have more disposables, and there is a huge push to have people that are not really qualified to do hair transplant buy these machines thinking that they can use technicians or somebody that's maybe trained in the artist to come into the office, perform the extractions. But then again, it's the full package because you got to pull them and then you got to place them. And you got to put them in the right way to get the right texture, the right curl, the right hairline. All that stuff comes into play.
Excellent. Thank you so much, as always, for taking the time. I always enjoy our conversations. Looking forward to the next one.
Awesome. Have a great one.
Thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your free consultation today with Dr. Danyo by simply calling 678-845-7521 or visit them online at nahairrestoration.com. And be sure to subscribe, rate, and review the podcast wherever you listen to your favorite podcasts.